doctor and get the book. Up next on Health Matters.
I would be in visiting her and she would start to die and they would ask me to leave the nursery and go wait outside.
Life is precarious for a premature baby.
Lindsay was so tiny and very, very sick.
Find out how new technologies are allowing younger and younger babies to survive a premature birth.
The ability to provide these babies with oxygen and the breath of life, so to speak, is the starting point.
And you'll learn what puts a woman at risk for a premature delivery. Also, you'll find out if being born prematurely causes children problems later in life. And later in the broadcast, a roundup of medical news and health tips from the Health Newswire. All that next. Health Matters, the Washington metropolitan area's source of medical news and health information, is brought to you by the members of the Medlantic Healthcare Group, the region's largest not-for-profit healthcare system, committed to excellence in patient care.
Hello, I'm Marjorie Margolis and welcome to Health Matters. 1 out of every 16 babies in this country is born prematurely. Even as recently as 10 or 15 years ago, many of those babies were given up for lost. We just didn't know how to care for them. Now improved technology and better knowledge means even the very smallest have a fighting chance.
Ride 'em, cowgirl.
Lindsay Hope Lawson is a 2.5-year-old bundle of energy. Her mother, Janet, has her hands full. But Janet doesn't mind, because for a long time, she wasn't sure she'd ever see her child play like this. From the very beginning of her pregnancy with Lindsay, she threatened to miscarry.
And then after the 20th week, they did an ultrasound and said, you've got it made. 95% chance you're going to carry this child to term. And 2.5 weeks later, I was in labor.
Janet was going to have a premature delivery, something she'd been through once before, 11 years ago.
I was 21 years old. I got pregnant, carried the baby 5 months. My water broke. And then with that pregnancy, I actually started into labor.
The doctors said there was simply nothing they could do to save the baby. She was born dead. Janet never even saw her. 22.5 weeks into her pregnancy with Lindsay, the nightmare began all over again.
My water broke. I knew immediately what was going on. I picked up the phone and called the doctor. It was at night. He said, come into the office first thing in the morning.
Janet was given drugs to induce labor. At 5:49 that evening, Lindsay Hope Lawson was born, alive but nearly 14 weeks premature and weighing only 1 pound 3 ounces.
And the doctor said, oh, it's not meant for a baby like this to make it. This child would probably be hospitalized 3 months and it would cost $200,000.
As it was, Lindsay was in the hospital far longer and at a much greater cost than that. But the staff did work to save her. A social worker there recalls that even Janet had her doubts that they'd succeed.
I remember that she was very afraid. Lindsay was very tiny. She was afraid she would hurt her. She was very afraid she would not live, and that was realistic at first. Lindsay was so tiny and very, very sick.
I would be in visiting her and she would start to die, and they would ask me to leave the nursery and go wait outside, and I would just sit out in the reception area and pray.
Lindsay's skin was like tissue paper and couldn't retain moisture. Her weight dropped to 15 ounces. She had kidney problems. She had to have surgery to repair a heart valve. She needed a respirator to breathe and was constantly connected to monitors. And the troubles didn't end after Janet took Lindsay home.
We just about lost her and had to do CPR. And those big blue eyes turned dark, dark brown. She was cyanotic. And she was making a moan, just like someone dying might make.
Lindsay Hope Lawson beat the odds. She lived. For every premature baby, though, it's a struggle.
A light source of transillumination.
Preterm delivery, although it only accounts for about 10% of all deliveries, accounts for about 75% of all newborn deaths and about 50% of all newborn handicaps. and is the #1 problem in obstetrics today still, the #1 cause of damage to the fetus or infant.
While respiratory problems are the most common difficulty for premature babies, they may also be born with mild to severe cerebral palsy, mental retardation, blindness, or deafness. Some children have congenital heart problems, are anemic, or have seizures. But babies that would have been lost only a few years ago are now being saved.
There's a whole range of technological know-how which has been adapted to the very, very premature baby, which is allowing us to help these babies survive. The ability to provide these babies with oxygen and the breath of life, so to speak, is the starting point.
New advanced ventilators allow the doctors to measure every breath the baby takes to signal if the baby stops breathing. Monitors keep track of the baby's heart rate, blood pressure, and brain waves. And special catheters that weren't available 10 or 15 years ago allow the doctors to feed the baby through the umbilical cord until it can take in food through its mouth. There are limits as to what medical science can do for these babies. Lindsay Lawson was born at what doctors call the lower limit of viability. It's extremely difficult to save babies less than 26 weeks of age or weighing less than 1.5 pounds. Just a few more ounces or a few more hours can make a world of difference in the baby's chances for survival.
What we're just beginning to do is now try and prevent prematurity, prevent preterm delivery.
That means monitoring the pregnancy itself very carefully and teaching mothers-to-be the signs and symptoms of preterm labor.
We tell them to watch for fevers and temperatures, which can set off premature labor, severe nausea and vomiting, which can cause a pushing sensation, and pushing sensations themselves, rectal, vaginal, or severe bladder pressure. We also tell them to look for changes in vaginal signs. A bloody vaginal discharge could be the cervix stretching open. Leakage of watery type fluid could be ruptures of the membranes.
Part of educating parents includes explaining the risk factors for a premature birth. Some of the major ones, having had a previous premature birth. A woman is at risk if she's under the age of 16 or over 35, if she has certain heart problems, or if she's had several children over a short time. Carrying more than one child is a risk factor, so is smoking.
Who is that?
Lindsay is the same size now as most 2.5-year-olds, although it does take most premature babies about 2 years to catch up to their peers. Lindsay does have chronic sinus and ear infections, mainly because of being on a respirator for so long. Since she hasn't been able to hear words properly, her speech is also a little garbled. Janet says she chose the name Lindsay Hope early in her pregnancy, when she was afraid she might lose her baby, and turned to the scriptures for comfort.
And I'm reading along, and it says, as we rejoice in our sufferings, knowing that suffering produces endurance, endurance produces character, and character produces hope. And hope does not disappoint us.
This is Diane May reporting.
Her doctor says Lindsay is going to be just fine. She may have some minor ear or sinus problems, but her growth is normal and her speech will be corrected. Not all premature babies are as lucky as Lindsay. While many more are now surviving, they still start out their lives at tremendous disadvantage. Researchers are only beginning to learn what they may mean in the long term.
Christine and Yvonne Scott are 21-year-old twins. They were born prematurely, about 7 weeks early, and weighing only 5 pounds each. Both paid a price for coming into this world. Yvonne is totally deaf, a not uncommon problem with prematurity. Christine had an even more common problem, respiratory distress syndrome. It affects about 50,000 premature babies every year.
We're talking about inability to keep the lungs open, to keep the air sacs open, so they tend to collapse, and it takes greater and greater effort on the part of the baby to try to breathe.
Dr. Philip Sunshine works with these babies in the intensive care nursery, using high-tech machinery to help them survive. But for 5,500 babies each year, that machinery causes another problem, bronchopulmonary dysplasia, or BPD.
And this causes lung scarring, and it causes narrowing of the small airways of the lungs, and it causes emphysema in the lung.
Dr. Northway is leading a research team that's trying to find out if BPD has any long-lasting effects on these children. They're testing Christine and others who have this disease to see how well their lungs are functioning now.
And just do nice, easy breathing.
And those tests involve having the child or young adult breathe through a tube, and then we measure the flow of air through this tube and the volume of air through this tube in certain periods of time, and that gives us a measurement of pulmonary function, both of the airways and also of the air spaces.
What Dr. Northway is trying to find out is whether there may be an underlying problem that even the patients themselves might not be aware of.
Very good.
Others will have symptoms that will resemble asthma, and others will just have some possible slight symptoms when they have a viral upper respiratory infection.
Just nice, easy breathing.
Obviously, also, they shouldn't probably smoke. Not that anyone should smoke, but they especially shouldn't smoke because of the small airway disease that they may have that may be unknown to them.
Dr. Northway won't have the results of his study for some time, but he and other researchers are all trying to answer the same kinds of questions. What happens to premature babies as they grow up? Will the physical problems they're born with stay with them all their lives? Will they be the same as other children emotionally and intellectually?
For instance, even though they may be normal intellectually as far as being able to solve problems and being able to achieve on a IQ test, we find that there's a greater incidence of hand-eye coordination, perceptual difficulties, and factors like that.
Dolores and Charles Scott say their daughters never had those kinds of problems, but they did notice Christine was a little bit slower in developing than her sister.
The growth development seemed to be normal, except Chrissy was always weaker, and if there was a little race that little kids would play in, she would huff and puff, and she was always the last one.
We started them in all the activities, all the sports that we could get them into, and then when they became old enough to put on a pair of skis, we started them skiing.
I would consider myself normal just as much as the other kids. I didn't see myself as any different, even physically.
The vast majority of the time, they tell us that the child is behaving normally, is able to compete, is able to participate, is able to achieve.
But doctors are faced with a dilemma. They're not sure it's always best for them to intervene, or that their intervention is always going to be successful.
No, but she was just getting a lot of blood from her gut. That was the only thing.
We've done a really remarkable job, but we don't know yet, because this therapy is so new, how they're going to do as a group as we move on to their adulthood.
Christine and Yvonne Scott are among the first of those extremely premature babies to reach young adulthood. No one knows for sure just how much they've been affected by the problems they had at birth. For them and the thousands of other babies born prematurely each year, the answers simply aren't in yet. This is Diane May reporting.
Prematurity has been linked with everything from later problems in school to child abuse. We'll talk more about that and about how you can make your own pregnancy safer when we come back.
You may have a physical condition that could lead to premature delivery of your infant. For a checklist of conditions that can affect you and your baby, write to Premature Infants, in care of Health Matters, the Medlantic Healthcare Group, 100 Irving Street Northwest, Suite 8102, Washington, D.C. 20010. Or you can call them at 202-877-5070. We'll repeat this address for you later in the program.
What's up, y'all? You know who we are. We're not your mother or your father. We're just some friends that care and want to talk about people that are stoned on drugs.
Next time somebody offers you drugs, you tell them take a walk, boy. You say, get out of my face. Be smart, don't be a fool.
Because it ruins the mind. We're for a positive mind education.
Just go to school, don't be a fool, don't mess with drugs or thugs, and you'll be cool.
Word.
The victims, kids who believe that a muscular body brings popularity and respect. The problem, for an alarming number of kids, steroids are the answer. The risks, mental illness, heart disease, even death. The reality, They could be your kids on steroids, living well-built lives. A News 4 exclusive report, tomorrow at 6.
Where do real people go public with their problems? And where can you find classic courtroom drama taken from real-life cases? Only on Superior Court at 4 and the People's Court at 4:30. Weekday afternoons on Channel 4. For the first time on TV, real patients, doctors, and solutions on Group 1 Medical at 9. Then at 9:30, the medical drama continues with fascinating, helpful information on Family Medical Center. Weekday mornings on Channel 4.
Mommy, there's nothing to eat.
Then we'll go out, Julie.
There are hungry people in our community. They have no choice. They have no food. On November 19th, put what you can in this bag, then leave it at your door. The Boy Scouts will take it from there. You'll help the hungry like Julie and her mom, who are sick of going out to eat. November 19th, Scouting for Food. They're hungry for your help.
Welcome back to Health Matters. I'm Marjorie Margolis. According to the latest statistics, approximately 17% of all births recorded in the D.C. area were premature. Why is prematurity such a problem in obstetrics today? My guests will try to answer that question and many others. With me are Dr. Jean Bolin, who is Director of Perinatology at Washington Hospital Center, and Dr. John Grouse, who is Chairman of the Neonatology Department at the Washington Hospital Center. Thank you for being with us. When we were looking at that tape, you said 5 pounds. That's a giant.
Well, it is for today. 20 years ago, 5-pounders got into trouble quite a lot, just like these twins in the tape that we just saw. But a 5-pounder today, in all likelihood, is going to be going home with mother from the hospital, or certainly within a couple of days after she goes, the baby should be ready to go. We have not seen severe lung disease in 5-pounders unless there is some other complicating factor for a decade or more.
It's a whole new day, isn't it?
Sure is.
What is your frustration with your patients? What would you say is the highest level of frustration for you?
Well, I think as an obstetrician, we have two things that are really frustrating for us. First of all, we have these situations where the mother's going to deliver early and we just can't do anything about it. No matter what we do and no matter what the patient does, it becomes inevitable. And we feel frustrated that there's not more that medical technology can do for her. And then on the other hand, we have patients who don't do anything to help themselves, women who haven't had any prenatal care, who use drugs, who smoke, who do all the things that the doctor on the tape mentioned could predispose someone to premature labor. And that's frustrating for us too, because we know that these women could be helped if they would help themselves.
If there's a history in a previous pregnancy of prematurity, I take it you are extra careful.
Oh yes. For one thing, the most important thing that the mother can do, particularly if she has that kind of history, is to enroll in prenatal care early, either with a private doctor or if she can't afford it with any one of a number of clinics. And one thing that we do is do an early ultrasound, again, like the doctors in the tape did, so that we know what the pregnancy dating is, so that we know where we are if complications develop. And that can be critically important. And then we alert the mother to report all of the warning symptoms that the doctors went over: vaginal discharge, any type of vague abdominal pain or back pain, and make sure that she knows when to call us and calls us early.
And I'd like to add to that, that when somebody already had a premature baby, she stands a much greater chance of having another one. And I think it's extremely important for them to be sure when they get pregnant, so that the timing of the pregnancy can be much more accurate than when we have to go back and retrospectively try to figure out how long the pregnancy is already gone.
It really is very important if you have premature rupture of membranes and are trying to decide whether the patient should be delivered or should be managed conservatively with bed rest in the hospital, or if the woman's in premature labor and you need to know whether to try to use a drug to stop labor. You have to know how far pregnant she is. And the early dating is very important.
I know you have something on your mind. Hold that thought. We're going to come back in just a minute. When we come back, we'll talk more about how accurately we can predict that premature delivery. And also coming up, we'll have headlines from the Health Newswire.
We always bring our family and friends to the Smithsonian. There's always something new to see.
Come see the dinosaur bones.
African pots, and so much more. Check out the fast car.
Live bugs you can touch.
Learn why Afro-Americans left the South to move north. It's all here at the Smithsonian. It's for everybody and for you.
Six o'clock. Work is over. The commute home is over. For today at least, the rat race is over. 6 o'clock. Time to turn on the news and catch up with the world. Unless you turn on Channel 9 for news. Because at 6 o'clock, the better part of Eyewitness News is also over. Now, only one newscast gives you a complete hour of local news, sports, and weather at 6 o'clock. News 4. We don't get home before you do.
Dear Channel 9, for years my wife and I had been accustomed to watching local news at 6:30 on Channel 9. Your decision to move everything up by half an hour makes it impossible for many to watch news on your station. We get home too late for that. So, we've switched to Channel 4, thank you. The only channel that keeps its senses about when to schedule news broadcasts. Sincerely, Dana Pratt.
News 4. We don't get home before you do.
We are talking about prematurity. What helps you out as a physician? I know that there are these wonderful reunions when the kids come back after a year, and I've covered some of these. It's one of the most exciting things in the world. You must be delighted.
It really is. It's very exciting. We have a lot of babies coming back. Last year we had about 90 families brought back their children. Most of them were very tiny.
Do you get teary?
Sometimes. And sometimes we get some very pleasant surprises. Babies who didn't look quite so good when we left them out of the hospital come back, and they're really live wires, and they're doing just perfectly well. And I think they will just merge into the rest of the community, and nobody will ever know they were premature.
How important is how the parent takes the prematurity to the normal growth?
I think it's very important, because the parents' expectations of their children tend to be fulfilled. And the parents keep regarding their small prematures as permanently small prematures. They tend to overprotect them, and they treat them really very differently, and then they turn out very differently.
How important to you is a week or a day with regard to holding that child?
A week can be critically important, particularly down in the very, very early gestations like the first baby that we saw on the tape. At 22 weeks, when this baby was born, the survival really is not very good. 24 weeks, it's much better. 26 weeks, it's 50–60%.
So it's crucial.
It makes a lot of difference.
Nutrition, feeding that little baby.
Well, I think feeding, besides the breathing support that Dr. Sunshine talked about, is the other very critical item, because we were able to breathe with these babies, or help them breathe, many years ago, but we couldn't feed them. So after a week or two, there's not much to these babies. They're mostly literally skin and bone. And after a few days, they just sort of fell apart. Intravenous feedings have really made the big difference to these very tiny babies.
Turn the corner.
Yes.
Something that you thought was very important when we were talking before was home monitoring.
That's one of the new things we're doing now for mothers who are known to be at risk. They have monitors that they can take home with them and send a tape of their labor pattern once a day to a special center that will check and see if they're having too many contractions, and then they call the doctor. It really helps.
I think it's important to realize that if you have risk of prematurity, a known risk, then a hospital that can deal with these problems at this level is much more helpful than a kind of regular community hospital.
I thank you both for joining us. And now, compiled from medical journals, reports, and research centers across the nation, news items and health tips on the Health Newswire.
Tetanus warning. Tetanus is a bacterial infection that most people associate with stepping on a rusty nail. 7 out of 10 tetanus victims are aged 50 or older. This is because most older people neglect to get booster shots, according to Morbidity and Mortality Weekly Report. Tetanus shots, which most of us get when we're young, are effective for about 10 years. As a reminder, the government recommends a tetanus booster shot every time you reach an age ending in 5, each decade for the rest of your life. Contaminated ice. The Journal of the American Medical Association reported an unusual method of transmission in a recent outbreak of gastrointestinal illness. 158 students attending a college football game suffered from upset stomachs or worse within 48 hours of the game. In all cases, the infection was traced to contaminated ice. This is unusual since ice is rarely a transmitter of infection. Furthermore, most of the ice was consumed in alcoholic drinks, which theoretically should have killed the germs. Hemoccult tests are commonly used to screen for colorectal cancer. But the tests simply check for blood in the feces, which means that ulcers and other sources of bleeding can yield a positive result. Certain foods, such as red meat, cauliflower, and horseradish, can cause a false positive. Citrus fruits and low roughage diets increase the chance for false negatives. And there are times when tumors may be present but not bleeding, and thus would not be detected by this test. And that's all from the Health Newswire.
We'll be back in a moment to tell you about next week's program, so stay with us.
For a free fact sheet about premature infants, send your request to Health Matters, the Medlantic Healthcare Group, 100 Irving Street Northwest, Suite 8102, Washington, D.C. 20010. Or you can call 202-877-5070.
Next week on Health Matters, we'll tell you the story of a man who put a bullet in his brain and about his doctor's desperate attempts to save his life using the latest medical technology. Thanks for watching. I'm Marjorie Margolis. Join us again next week because health matters.
Health Matters, the Washington metropolitan area's source of medical news and health information, has been brought to you by the members of the Medlantic Healthcare Group, the region's largest not-for-profit healthcare system, committed to excellence in patient care.
Sunday morning, 8:30, teams from Osborne and Manassas, Thomas Wooten in Rockville, and West Springfield in Fairfax County meet on It's Academic right here on Channel 4.
Something funny's going on.
What's this, a joke?
It's the funny women.
Come on, let me in on it.
Versus the funny man.
I don't get it.
So get your kicks.
I just don't get it.